You wear a second hat.
I do.
Let's talk about that.
Well, in 2018, the practice that I was involved with stopped functioning as a solo practice, or as a group practice. And I was aware of and contacted by the Carolina Family Health Center group, which is a rural health group centered in Wilson. They have a clinic there in Wilson and one in Freedom Hill outside of Princeville, and they have one on Highway 58 near Elm City between Nashville and Wilson. It's called the Harvest Clinic. And they have 17 to 18 providers in those clinics, and they needed somebody to help them with their referrals for abnormal pap smears. And there were a lot of them, and they had gynecologic problems that needed gynecologic referrals. These patients were often self-pay, and so they would make the referrals, but the doctors, the offices that they were referred to, demanded some type of upfront payment, which I can understand, but they couldn't pay it, and so then they never followed through with their referral, and so what we ended up doing was constructing a system where we had internal referrals. And so I went there 2 days a week, and so anybody that needed a GYN referral would just come to me, and we could do the colposcopies, we could do the LEAP procedures, which are a treatment for cervical pre-invasive disease. We can do DNCs, and we have access, because of a federally funded pharmacy, to some fairly good prices for some drugs that can help patients who have problems with abnormal bleeding. And so we've been able to sort of construct a gynecology referral service in this group of people that probably 60% of them or 70% of them are self-pay. So, you know, whereas some people would say or think that Medicaid or Medicare patients were not very financially well off, in our world, they're the best. We think that somebody has Medicaid or Medicare, we think they have insurance. Probably 70% of our patients don't have, or self-pay patients, they don't have anything, and yet we find a way to see hundreds and hundreds and hundreds of them every week and keep the ball rolling.
And it's a sliding fee schedule. I mean, if somebody can't pay, then y'all find a way to provide the treatment they need anyway, right?
That's correct.
But nobody's denied any care.
That's correct.
What about, now, Harvest? Where did the Harvest come from?
Well, that was the original name for the clinic, and I was told that some Catholic nuns initiated that clinic decades ago, and it existed out of a couple of old trailers, and it was subsequently taken over by the Nash County Health Department. And then subsequently, then it was, the ownership of it was transferred to the Carolina Family Group, and they were able to find the grants and the funds to build a nicer clinic, and it exists now like that. But what we find, and people wouldn't, you know, unless you work there, you wouldn't know it, probably, you know, 33% of our employees are bilingual.
And need to be, right? Because a lot of the patients don't speak English.
And we have interpreters at all levels of where we work.
Good.
So that if I have a patient who doesn't speak English, I have an interpreter in there along with a nurse. So it still slows things down a little bit, but they're still possible. You know.
I've known you a long time, and I really want to point out that I can tell this means a whole lot to you to be practicing this type of medicine. I mean, it seems like it's really, having done what you've done up to this point, that it brings you great joy to know that you're ministering, in essence, to people who couldn't get care otherwise.
That's the truth. Most of them could not get care. And, you know, I'm especially thankful and proud of some of the situations that have developed in Eastern North Carolina. There's a doctor who's moved to Greenville, and I'll go ahead and mention his name. It's not Dr. Granger Leno, who is a GYN oncologist, and he has reached out to me and said, please send me your patients, we'll take care of them. And we have probably more than we should patients that show up and they have GYN cancers because they've had problems for years and they just haven't been attended. And so after working them up and diagnosing the problem, he has been a source of referral and very responsive to surgery. It's very advanced robotic surgery, and he sends them back and the patients are taken care of. And I'm proud of that. I mean, we've done good work for a lot of people.
Yeah, and the Harvest Clinic refers not just for GYN as well.
Oh, it's a primary care facility. One interesting thing is that Dr. Peter Muller, who works at the Wound Care Center, also works at the Harvest Group 4 days a month. And basically, he does all their minor surgery. So if someone comes in with a large lump or something that needs to be excised, he'll do it for them. And he does that one day a week. So, you know, we've got at the Harvest Clinic, and I don't know what it's like elsewhere, but that group in Wilson takes care. They have a Ryan White program, which is the federally funded program that provides care for HIV positive people. They have over 550 patients enrolled in their Ryan White program in Wilson, North Carolina. And most of them are from Nash and Edgecombe County.
I remember when I worked at Almonds Drugs, we filled a lot of those prescriptions, and they always came from that clinic. Because that seems to be the real go-to place and support place for people in need of that care.
But it's something to be proud of.